I have worked with my colleagues for nearly a year now, or over a year actually, to try to respond to what is a public health epidemic in New Jersey. And not just in New Jersey, the CDC says that it's a national crisis, and it is, and it's really acute here in the state. This isn't just say no. This isn't just don't do drugs and here's a balloon and wear a wristband and double promise you'll never do drugs. This is what are those strategies that really talk about drug addiction and those problems, and meaningful ways for a fifth grader, and then for an 11th grader. So how do you have those conversations with different age groups in the school system? And so one of the bills out of the 20 directs the Department of Education and the Department of Human Services and Health to work together on a strategy. We do separate mental health, of course, from other physical illnesses, but they're all the same. And the problem is that there's a stigma attached to mental health and substance abuse. Many times there's a co-occurring issue in substance abuse. So someone who has a heroin addiction or an opiate addiction, or they're both opiates, but addiction to prescription drugs, they have underlying co-occurring issues. It could be depression. It could be any number of things. They're self-medicating because they have personal issues in their life, or they have a depression issue, or they have some other issue. And so it's when we're treating someone for their substance abuse, or for their addiction rather, many times there are co-occurring issues, and that's why it's important to have smart, thoughtful counselors doing the right thing, getting to the root of the addiction. Some people have more of a physical propensity to become addicted. Their brain is wired differently, but many times it is a co-occurring issue. I'm chairman of the health committee for a reason, because I want to be, and because there are issues that we face as a state and as a community that we need to address. Sometimes God willing, we think we can solve them, and so we have a great staff, by the way, and we're all sort of like-minded, and we all want to do all that we can. And we don't kid ourselves. Legislators think sometimes we think that we could do a bill, we're going to fix something, and it's going to be great, and walk away. Sometimes those things are easy, and we can sometimes do that. But on long-term stuff like this, it takes a while to design it, because at the end, if anything that we propose or I propose can't work, we're going to know about it. We spent over a year sort of agonizingly going through all the data, traveling to Washington, traveling to Chicago, going to Seattle, talking to all the experts and getting it right. So that's what I think we've done here. And look, this is not the end of it. There are other legislators who have some other great ideas and some other things, and we're going to talk to them as well. But we want to make sure that this is a collaborative effort, but this is sort of a holistic strategy that touches all the different elements of addiction.